Hello everyone, my name is Dr. Roshan Naik and today I'll be talking about the Merify for the mastitis detection strips. How do we use it? And also about on the result interpretation. First of all, whenever you have the bottle, always make sure that the lid is facing upwards. Never while removing the strips, never tilt it or upside down because you have the risk that all the strips may fall out and they will be unusable, okay, when they come in contact with the ground. So always hold the lid upside, facing upside. Then with your thumb and the forefinger, pick up just one strip, okay, like this. Okay. Then immediately close the lid and make sure that the orientation of the strip, you compare it against the color chart given and make sure it matches. If not, sometimes they may be in different orientations, so make sure that it matches before you start testing. Then immediately dip the sample into the strip into your sample. Make sure only these 4 chemical pads, the dip for 5 seconds, then remove it and wait for 2 minutes before you start analyzing the results. Also, make sure that they should not come in contact with any of the samples. So once you have removed, immediately start to analyze. So now coming to the assessment part, okay. So this is about the guidelines. I have told you about handling the bottle, then removing the strips, then you have dipped it for 5 seconds. Excess liquid you can, drain off by touching the rim of the container in which you have the sample. Okay, not these one. Then subsequently, first always start with the pH assessment. Okay. As you can see here, the pH of the normal milk would be around 6.4 to 6.8. So it would look like yellowish here. Okay? That is normal and it is in the acceptable range. So if there is a potential infection, it will be yellowish green to green, moving upwards towards 7 and 7.5. Okay. Then next, we'll go to the leukocytes. The normal baseline is white or faint pink in color, sometimes faint pink you can see. Then it is an inflammatory marker. So dark pink to purple in color indicates elevated somatic cell count. Please note, this is not an absolute somatic cell number, but is a relative number. It gives you an idea there is an increase in the somatic cell number, but not absolute level. Subsequently, we'll go for the blood cell evaluation. So the normal baseline color you can see is yellow to orange color. Okay, yeah, on that. Then whenever there are intact red blood cells, they would show around 10K, around approximately 10K per ml. So it will show around orange to yellowish color, as you can see. However, hemolyzed are the RBCs, which are cells broken down, and there is a release of the hemoglobin and all. These are usually caused by gram-positive bacteria such as Streptococcus, Staphylococcus aureus species, or some of the intracellular blood parasites, and even certain viral infections. So when these infections are present and they cause red blood cell lysis, then you know these are the potential organisms may be present. And lastly, we go to the nitrite detection. Normal baseline is white in color. Okay. And presence of any bacteria, any colors you may see from yellow, orange, pink, or red color confirms bacterial presence. And usually this works for nitrate reducing organisms such as E. coli, Klebsiella pneumoniae, Staphylococcus aureus, and selected Streptococcus species. But remember, the detection threshold for this is 10 micromolar per nitrate. So any levels higher than this will be detected for presence of nitrate produced by the bacteria. Thank you.